But so, what's your thoughts on? Or do you think people are taking it serious now? Because I know there was a lot of reports of like when it first started, they were telling people to social distance. A lot of people are still never mind. I'll social distance, but they're not. They weren't. You know what I mean? They were still going to. People were still going to bars, and there was videos of. And this was more in the States, people at the beach and stuff like that. But even here in Winnipeg, there were a lot of people at the park, playgrounds, still hanging out with each other and stuff like that. Do you think these days now people are taking it a little more seriously? Or?
Yeah. I think it's hit home in Winnipeg, which has been, like second week of March, it was still pretty distant from us, at least in feel. But I think it's people are taking it seriously here now. March 11th was when the World Health Organization declared it a pandemic. And the day after the first case of COVID-19 was identified in Manitoba. And now we have 182 confirmed or probable cases, and there's probably many more out there that we don't know about because of testing constraints. But yeah, I think people are taking it quite seriously now. I think in the U.S. it was a really bizarre situation because the president was pretty intent to downplay the severity of it, and all his idiot rube followers took that to mean that it wasn't a big deal until it was too late, until you had states having to do like real lockdowns and shelter-in-place orders. And
I think New York is getting hit the hardest there, so far that I've seen.
And they're getting hit the hardest. A lot of cases. They don't quite have enough ventilators, it looks like, for their demand. So
I feel so bad for the people in that are working medical staff, doctors and nurses and stuff like that. They must be feeling like super helpless and just overwhelmed unimaginably right now. It is quite the strain on the healthcare system, and I mean, hopefully we don't get to full capacity here. Hopefully these distancing measures do the intended effect of slowing the curve of COVID cases enough so that we don't hit capacity in the hospital system, because that's sort of what those horror stories coming out of Italy were all about. Italy, Spain. Oh, they're just getting shit kicked. So what's your thoughts on how the response has been here? Let's stick to Manitoba here.
Yeah, I think in Manitoba, like all the like most of the provinces, I'd also say this for generally, has been very good at what I'd call the narrowly public health oriented side of the response. So public health officials are saying that this is a risk. The government of Manitoba, the decision makers, the premier and cabinet, so to speak, hear that, and they've mostly been following sort of the lead of the public health officials, it looks like, in taking it seriously and in saying things have to shut down. And we've been doing that very quickly in Manitoba before we've gotten to the point where Ontario or the other provinces that were hit before us did.
Yeah, I think generally Canada, it feels like they've done the best that they could, and they listened to the science and the people, the health people and stuff like that, right?
Yeah. Like you don't have this stuff like this dumb stuff going on in the U.S. where you have the president who was like, "Oh, no big deal," and we'll have everything open by Easter. And then after downplaying it for months, pivoting to, well, actually, it is serious, but it's the China virus.
I know, he's trying to change the whole narrative of...
Yeah.
It's so frustrating.